And this young man who's going to come in right now has agreed to allow me to show you how to do some of the stretches, just with basic instruction. So stretching is one of the most important aspects of care for Duchenne. It can help to maintain or increase flexibility, make movements easier to do, affect safety when standing and walking, deter invasive surgery, and make sitting and laying down positioning much more comfortable. Without an appropriate stretching program, someone with Duchenne is at severe risk of earlier loss of walking, injury, significant joint contractures, and pain. So our first of about 6 stretches that are with the typical program is the hamstring stretch. What you want to do is bring the leg up so that the hip and body are at 90 degrees, and then you hold that steady there while you slowly raise the foot upward. Go ahead and relax. And when you feel tension, you stop and hold it. Remember, 60 seconds is ideal. After the tension starts to give in, you take up the slack and push a little more. And then bring it back down. And then repeat on the areas that are problematic. Another important area is the gastroc and Achilles. And what you're going to do with your hand cupped, place it under the heel. Go ahead and relax. Place it under the heel with the forefoot on your arm. You're going to put the leg down, make sure the knee is not hyperextended. Keep everything down and slowly pull downward on the Achilles and then hold that stretched position. And that's for the gastroc and the Achilles. You want to make sure that you're not just pushing on the forefoot. Okay? In this position, which we call supine, laying on your back, hamstring and gastroc are easy to get to. Also, forearm supination is an area we want to take real good care of. And what you're going to do, I'm going to show you on the arm closer to you, is bend the elbow 90 degrees and keep it at the side. And then the forearm is this portion. This is pronation, this is supination. You want to turn the hand, the palm, up towards your son's or your patient's face and hold it there, getting as much supination as you can, which is this position. Again, 60 seconds would be great. Also in that position, with the hand facing you now, you want to tip the wrist back to get wrist extension, and then with your other fingers, slowly slide the fingers straight and get wrist and finger extension at the same time. A lot of times you'll see the fingers curl in, and that's from tension. So you want to slowly, as much as you can, straighten those out. Okay. Now I'm going to have you roll over on your stomach, please. So now that he's in this position, we can get good stretching on the IT band and the hip flexor first. What you want to do is bring the leg up, cradle the knee in your hand and his lower leg in your arm, stabilize the pelvis with one hand. You're going to pull up and then towards you, crossing the knee close to midline or across if you can. This gives a good stretch for the side of the hip here and the front of the hip there. And again, hold for 60 seconds if you're able to. In this position, we can also get a good stretch on the soleus, which is the second major muscle in our calves. So what you're going to do here is bend the knee 90 degrees, so the leg is upright this way. Grab with both hands close to the heel and gently push down. Make sure you're feeling that stretch through here. Do not place your hands towards the toes, because then you're just stretching the foot. We want a good ankle stretch like this. Okay? So that's just a quick review of the 6-7 main stretches that almost all of our boys with Duchenne can benefit from. Stay tuned for upcoming video blogs, including school adaptations, serial casting, wheelchairs, scooters, pool programs, and more, including a full-length stretching video. Thank you very much. Bye.